السلام عليكم ورحمة الله وبركاته. المحاضرة السابعة للمفاصل بعنوان Systemic Sclerosis and Scleroderma. Scleroderma is a generalized disorder of connective tissue affecting the skin, internal organ, and vasculature, and it is characterized by thickening and fibrosis of the skin with involvement of the internal organ. يعني هو disorder راح affected connective tissue زين الموجودة بالسكين زائدا internal organ زائدا vasculature. Epidemiology الانسيدنس مالته هو about 20 patient per 1 million and the age about 35 to 50 years old. Female to male ratio about 4 to 1. Classification two major subset اللي هما limited scleroderma okay limited scleroderma and ما أعرف يعني شو سبحان الله أي خربط الحاسبة أي limited scleroderma and diffuse cutaneous scleroderma. Limited scleroderma is more benign than diffuse scleroderma. Limited scleroderma involve راح يكون عندنا limited من اسمه limited involve the face, neck, area distal to the elbow and or knees sparing the trunk. Okay? And while diffuse type it is involved widespread area proximal to the elbow or knees and or the trunk. Another title اللي هو CRIS syndrome هو is a form of limited scleroderma اللي هو راح يتكون من الكريس مختصر calcinosis, Raynaud phenomena, esophageal dysfunction, sclerodactyly اللي هي scleroderma limited to the fingers and telangiectasia. Clinical feature. It is widespread disease involve the skin and multiple organs. In the skin, initially there is non-pitting edema of the finger and flexor tendon sheath, and subsequently the skin becomes shiny and taut, قوي, and distal skin creases disappear. This is accompanied by erythema and tortuous dilatation of capillary loop in the nail fold bed. The face and neck are usually involved next بعد ما يصير بالإيدين بعدين الفيس and the neck are usually involved next with thinning of the lips and radial furrow. زين راح يكون خطوطي على طول اللبس. Raynaud phenomena. This is a universal feature يعني هاي دائما موجودة and can precede other feature by many years. Involvement of small vessels in the extremities may cause skin ulceration over pressure area, localized area of infarction, and pulp atrophy at the fingertips. Okay? إذا تذكرون بالرينود فينومينا جبنا سؤال بالامتحان مسقما لي أغلبكم يمكن غلط كان هو دائما يمشي مع سكليروديرما. musculoskeletal feature راح يكون عندنا arthralgia يعني pain in the joint, morning stiffness, and flexor tenosynovitis are common. Restricted hand function is due to skin rather than joint disease يعني لأن راح يصير fibrosis بالسكين راح يصير limitation بالfunction ما من صوت الجوينت وإنما صوت السكين راح يكون tight skin. Muscle weakness and wasting can occur due to myositis راح يكون عندي inflammation بالمصل. Gastrointestinal involvement like smooth muscle atrophy and fibrosis below 2/3 of the esophagus lead to reflux with erosive esophagitis. Dysphagia and odynophagia may also occur. Involvement of the stomach cause early satiety and occasionally outlet obstruction يعني يشبع بسرعة و sometimes يصير عندي gastric outlet obstruction. Recurrent occult upper GIT bleeding may indicate watermelon stomach اللي هي antral vascular ectasia. Small intestinal involvement may lead to malabsorption due to bacterial overgrowth and intermittent bloating, pain or constipation. إذا راح يكون مرات عنده غازات، مرات يكون عنده إيش؟ pain and constipation. Dilatation of large or small bowel due to autonomic neuropathy may cause CETO obstruction with nausea, vomiting, abdominal discomfort, and distension, often worse after food. فهذه بنشوفها feature مال إيش؟ autonomic neuropathy. Pulmonary involvement. This is a major cause of morbidity and mortality. يعني إذا نقول لكم وين يموت البيشنت قولوا لي إنه pulmonary cause. Pulmonary hypertension complicated long-standing disease and is more prevalent. وين راح نشوف pulmonary hypertension؟ بالlimited زين type than in diffuse type scleroderma. هذا دائما نجيبها MCQ بالامتحان. It is presented rapidly progressive dyspnea, right heart failure, and angina often associated with severe digital ischemia. Fibrosing alveolitis هسه ما pulmonary إنما lung tissue mainly affected patient with diffuse who have topoisomerase antibody positive. Okay. إذا fibrosing alveolitis إذا lung tissue affected راح نشوفه بالديفيوز. إذا بس pulmonary hypertension راح نشوفه بالlimited. ركزوا بيه لأن هذا دائما يجي بالامتحان. Renal involvement. One of the main cause of death is hypertensive renal crisis. Characteristic. طبعا كل ما أشوفه patient عنده resistant hypertension لازم يكون renal. Characterized by rapidly developed malignant hypertensive and renal failure. Hypertensive renal crisis is much more likely to occur in diffuse type of sclerosis than in limited, and in patient with topoisomerase 1 antibodies. Causes unknown. عادة causes unknown. Extracellular connective tissue activation, immunological abnormality, inflammation, and vasoconstriction. Differential diagnosis عندنا dermatological and systemic differential diagnosis. بالdermatological راح نشوف الفينجر مثل mycosis, fungoidosis, amyloidosis, porphyria, cutaneous tarda هاي كلها تشبهها. Systemic مثلا pulmonary fibrosis, primary pulmonary hypertension or cardiomyopathy, GIT dysmotility problem and like SLA. Okay. Investigation. Scleroderma is a primary clinical diagnosis. ESR usually elevated, but C-reactive protein tend to be normal unless there is severe organic involvement or coexisting infection. دائما C-reactive ينطينا فشي acutely. ANA is positive in about 70% of the patient, and approximately 30% of the patient with diffuse have topoisomerase antibody positive. Okay. About 60 patients with CRIS syndrome have anti-centromere antibody. إذا لو جبنا topoisomerase وراح نشوفه بالديفيوز. زين. بينما الانتي-centromere راح نشوفه بالكريس تايب اللي هو limited. Imaging and other study. مرات نحتاج imaging حتى نشوف arthritis راح ندز radiography. GIT نحتاج مرات endoscopy, esophageal manometry, barium swallow. بالpulmonary نحتاج echo, نحتاج pulmonary function test, نحتاج CT angio. زين. نحتاج cardiac catheterization, renal biopsy and skin biopsy sometime. Management. No treatment are available that halt or reverse the fibrotic changes that underlie the disease. The focus of the management, therefore, is to ameliorate the effect of the disease on target organ. إذا نحن راح نركز وين حتى نحاول نخفف أثر الديزيز على target organ. Raynaud syndrome and digital ulceration should be treated by avoidance of the cold exposure. ما يطلع على البرد. Use mittens. Then heated mittens are available. then supplemented if necessary with calcium antagonist. Bosentan can be of value in promoting healing of digital ulcer. In infected ulcer, sometimes we use antibiotic. Esophageal reflux should be treated with proton pump inhibitor and anti-reflux agent. Okay? Antibiotic may be required for bacterial overgrowth syndrome, and metoclopramide and domperidone may help patients with symptom of pseudo-obstruction. Okay? Hypertension should be treated aggressively with ACE inhibitor even if renal impairment is present حتى نحافظ على renal function and to avoid end organic damage. Joint involvement may be treated with simple analgesia. Pulmonary hypertension may be treated with bosentan, and selected patient heart lung transplantation may be considered. ولا تنسون إنه هو cause of the death. Most common cause of. Another title اللي هو mixed connective tissue disease. لاحظون إذا ال SLE ولا الروماتويد ما يجي بأحد ومرات يجي معاه other disease autoimmune. فإذا صار عندي SLE و systemic sclerosis and myositis may all occur in the same patient, most commonly presented mixed connective tissue disease. This is most commonly presented with synovitis and edema of the hand in combination with rhinoid phenomena and muscle pain or weakness. Most patients have anti-ribonucleoprotein اللي هو RMP antibody, but this can occur in SLE patient without overlapping feature. يعني SLE بحد ومو mixed connective tissue disease. Management focus on treating the individual component of the syndrome. يعني وحدة نهاية. يعني اللنج نعالج واحد والسكين بحد وother organ بحد. Another title اللي هو polymyalgia rheumatica. Polymyalgia rheumatica is a disorder of unknown cause affecting older patients, and it is characterized by shoulder and hip stiffness with elevated ESR. إذا من تشوفون shoulder pain, hip stiffness and stiffness with hip stiffness and elevated ESR فخلوا بالكم polymyalgia rheumatica. Physical finding and clinical presentation. Symptoms are insidious or sudden. Neck, shoulder, low back pain and thigh pain. Morning stiffness more than 2 or 3 hours is typical. Malaise, weight loss, depression and low-grade fever. Synovitis may be present in peripheral joint and may be responsible for proximal girdle symptom. Okay. Mild soft tissue tenderness. Distal extremities manifestation راح تكون knee, wrist, metacarpopharyngeal joint. Polymyalgia rheumatica has a strong relation to temporal or giant cell arthritis. عادة polymyalgia ولا giant cell arthritis عادة يصيرون بالold age. Differential diagnosis هنا راح يكون rheumatoid arthritis أو the first differential diagnosis لأن عندي stiffness and pain. بس هنا شلون يكون ال RF rheumatoid factor is negative in polymyalgia rheumatica. Polymyositis لأن يصير عندي proximal muscle pain and weakness. Enzyme study are negative in polymyalgia. And another title اللي هو fibromyalgia. زين هنا بس راح نشوف pain بس نجي نفحص normal examination. Okay. The diagnosis of polymyalgia rheumatica is suggested by following finding اللي هو pain and stiffness of pectoral and pelvic musculature يعني proximal أو limb girdle. Patient age more than 50 years old. Morning stiffness more than 1 hour. Normal motor strength. Symptom for at least 4 to 6 weeks. Elevated ESR and rapid clinical response to low dose corticosteroid. فعلا يعني كثير مرضى نشوفهم نعطيهم challenge يعني هو التريتمنت diagnostic therapeutic نعطي steroid يرجعونا بعد أسبوعين نشوف كلش كانوا تحسنوا على العلاج. Laboratory test طبعا نحتاج حتى ندور على other disease. Complete ESR rheumatoid factor should be performed. Mild anemia may be present. Okay. بس rheumatoid factor وال ESR طبعا هو كلش high بس rheumatoid factor are negative should be negative. Treatment with prednisolone 10 to 20 mg per day is given. The response is within 24 hours to 84 hours can be confirmed the diagnosis. Steroids are gradually tapered over the next few weeks, but a small dose 5 mg per day may be needed for 2 years or longer. Non-steroidal anti-inflammatory may be tried in mild cases. Physical therapy is usually unnecessary. And thank you.